Hello, I'm Dr. Patrick Hwu, CEO of Moffitt Cancer Center, and we're in Houston, Texas at the 2024 SITC annual meeting. And I'm here with Dr. Tiago Biachi. He is an expert in GI malignancies, and he's doing a very interesting study with neoantigen vaccines. Welcome.
Thank you. Thanks for having me here. Yeah, this was a phase 1 trial including patients with pancreas cancer, gastric cancer, and non-small cell lung cancer. So this is a trial, in progress, assessing safety, tolerability, and a lot of translational data, with this. So essentially, we're doing biopsy in those tumors. We're manufacturing this neoantigen therapy called RNA 4157, and then we infuse back to those patients combined to the standard of care chemotherapy, so in adjuvant setting. So we're looking forward to see more translational data and, of course, improve outcomes for those patients.
So this is a personalized vaccine. So the patient's tumor is sequenced, and how many antigens are then given to the patient?
Yeah, that's a good point. So we know that we have several, vaccine trials out there. So this is a personalized neoadjuvant therapy, and they can encode up to 34 neoantigens in this. And it's interesting that they published last year for melanoma, and the phase 2 trial was very positive, and now they have phase 3 trials with melanoma and other solid tumors, and now we're testing this approach in those cold tumors outside.
So how does it work? Does the patient get surgery for their, let's say, pancreatic cancer, and then from that the tumor is sequenced and the vaccine is made? And so after the surgery, there may not be any evidence of disease. They get the chemotherapy, and then they get the vaccine to try to prevent the recurrence?
Essentially, this is for curative settings. So for pancreas cohort, those patients, had surgery, and then we're going to ship this. We're going to sequence this tumor. We're going to ship this to be manufactured using, genetic engineering, and then once this, comes back, we're going to combine this with chemotherapy, and we're going to continue this up to 16 cycles. For those cohorts with gastric cancer and non-small cell cancer, we're going to use this before and after the surgery to see actually combine to the standard of care chemotherapy.
After the surgery, how long does it take to make the vaccine and get it back
That's
to you?
a very good question, and we were asked many times, yesterday. It varies, I would say. They're trying to push this to be like as soon as possible. I would say it varies something between 4 and 6 weeks, which is very reasonable, I would say, because this is a period of time, after, for example, pancreas surgery, that the patient would not be able to receive chemotherapy, for example. So while the patient is recovering for the surgery, we're going to be manufacturing the INT.
What about how long will they get the vaccine for?
So depending on this, each cohort has a duration of treatment. But for example, for the pancreas cohort, they're going to receive this for up to 16 cycles, and this is injected every 3 weeks intramuscular, combined to the chemotherapy.
Great. And then besides looking to see what their outcomes are, if they recur or not, you're also going to be monitoring the immune cells in the blood?
Exactly. So we performed apheresis for those patients before and after treatment. So we'll have a lot of data coming early next year for translation analysis, and to see if this approach can really invigorate the immune system for those patients.
Well, it's a very exciting study to do personalized vaccines for GI malignancies and other cancers. So congratulations and good luck with the study, and thanks for being here with us today.
Thank you so much. Appreciate it.